Hi there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health in the Peoria Metro Center and our YouTube channel, Health and Horsepower. I wanted to come here today and talk to you a little bit more about 3 common causes of headaches that are often overlooked. So the first one that I find a lot of times is when you go to a doctor's office and you're complaining of headaches or migraines or things like that, especially if they're intermittent or come and go and they don't seem to follow a pattern, we may actually have issues with our jaw alignment or even the cranial bones in our head. If those bones aren't moving properly, or if we have layers of tension, so you have bones that make up your skull that are called, they basically come together in what's called a suture. So like where those bones come together, there's almost like a line of cartilage in between. And what can happen is if we're having tension, so if you're under stress, if you are dehydrated, if you've been clenching your teeth or upset about things, and you tend to hold tension in your neck and shoulders, what'll happen is as you're tensing up, those muscles that overlie your skull tense up and actually jam those bones together. And that can cause pressure on the fascia and the coverings that actually protect our skull, and also the coverings kind of around our blood vessels and our nerves inside of our head. So what can happen is as we get that tension pressing up against there, we actually can irritate those nerves and irritate those blood vessels, and that can cause pain that can represent like a headache, or sometimes we'll get more of like a pressure sensation that can happen in our head as well. I also see this a lot of times if we have misalignment of our jaw. So your lower jaw is only held together and actually held to your skull by ligaments and muscles. So your jaw actually opens down and then glides forward across this bone at the base of your skull. So if we have tension on one side of the jaw, if we tend to chew on one side, if we've had an injury to the jaw, or potentially even some dental work that's caused those muscles to stretch on one side, that can cause that jaw to shift, rotate, or muscle tension. So when you open the jaw, it opens and actually veers off or opens faster on one side if that's not balanced. And when that happens, if those muscles move faster on one side, they push against the other side and can cause tension, which can also contribute to headaches on that side of the head because it's going to cause that same muscle tension that can contribute to a headache. Another common cause thing, so number 2, would be more of kind of like a cranial pressure due to sinuses and allergies. So if you have a lot of internal pressure buildup in your sinuses or due to drainage and allergies, that can cause pressure from the inside out that can also irritate those same nerves and ligaments and also the coverings of our spinal cord and our brain that can also contribute to headaches. So if you're dealing with sinus issues, one of the most important things I find is we need to make sure that the bones of the face and the bones of the neck and the muscles in the neck and soft tissue in the neck are able to stay loose so that everything can drain out of our sinuses and actually behind the ear and down the sides of our neck. So if we're having any neck tension or muscle tension, that can cause some issues where basically because we have muscle tension here or bones shift out of place, not allowing things to drain properly, that pressure can build up, leading not only to sinus and allergy drainage issues, but I've also seen eventually in some cases if you have chronic sinus issues going on, it can lead to a sinus infection or sometimes even ear infections if that stays in there, because when you have a moist inflammatory product that's in that area for a long period of time, that's prime conditions for bacteria and also fungus to grow. So a lot of times we can actually have fungal infections going on in our sinuses that can cause chronic sinus infections to keep coming back over and over again, even after multiple rounds of antibiotics. So typically I find that maybe a matter of looking at chiropractically to make sure that your bones and also the drainage pathways are working properly. In my office, I do a combination of cranial work. So I actually do massage, pressure, and also adjustments for the bones of the face, the skull, the jaw. I also give home exercises for those. In some cases, we may even need to look a little bit deeper to see why are we having these inflammatory products. So sometimes it may be a matter of looking at seasonal allergies and what we can do to support that, or looking at possible food allergies where your body has inflammation on an ongoing basis that causes those seasonal allergy symptoms to be much worse because we have a pretty standard level of inflammation just from food allergies, and then once we add seasonal, they kind of go through the roof. Another very common cause that I see is hormone imbalance, which if you know, or maybe you don't, When we have our menstrual cycles, or if you're past menstrual cycle and in menopause, you're still going to have cyclical changes with your hormones, just not as drastically as when you're menstruating. Typically, as we look throughout our cycle, we typically have ups and downs. So around ovulation, you're going to have certain pituitary hormones that rise, but you're also going to have your estrogen level goes up. A couple days later, progesterone's supposed to follow. But if you're under chronic stress, or if you're having chronic pain, or if you have autoimmune conditions or many health problems, your body may be stealing that progesterone away. So when estrogen rises and progesterone's not following, we can actually see more of an issue where progesterone stays low and doesn't balance the estrogen. And that can cause a lot of issues for blood flow, tension. A lot of times when I see women that are having hormone imbalances, I've seen everything from like joint pain. So like they wake up and they feel like they got hit by a truck, even if they didn't do anything really in particular that's out of the ordinary for them. I've had some women that report if they do a workout during that, usually about a week or week and a half before their cycle, they may actually injure themselves. I've also seen some issues with digestive problems during that same time period. But when your body's under chronic stress, whether that's from pain, mental, physical, emotional, whatever else is going on in your life, those hormones can actually be stolen away because of stress, and that can cause hormone imbalance that can lead to everything from immune system disorders, digestive issues, sleep problems, fatigue, energy production problems, you name it. I've seen a lot of different things that are affected. So if you're noticing that you're having headaches, typically before or during or after your cycle, there may be some hormone balance issues going on that need to be investigated. A lot of medical doctors and OBGYNs typically do like screening hormones just to make sure you're making hormones. They don't necessarily look at like bioactive, bioavailable hormones compared to each other. So like I said, normally if we're looking at like estrogen, progesterone, testosterone, and we're in normal range, but we're still having symptoms of hot flashes and all these other things, you may need to look a little bit deeper and actually look at bioactive hormones. So we may have all of this hormone in our body, but how small of a part of that is actually active, able to go out there and do its job? If you have not enough bioactive hormone out there, that may mean even though you have the hormone there, it's bound, it can't be utilized, and we need a bioactive actually that's unlinked, able to go out there and do its job. So if we're having issues with hormone imbalance, sometimes it's not necessarily that you don't have the hormone, but it's more necessarily you don't have the functional portion of that out there doing its job, and we could have an imbalance with that. I know in my office, typically I sit down to make sure that number one, we are getting the right things in our diet and digesting them well so that you have all the resources and nutrition coming in. But if we're having issues with hormone imbalance, we may need to take a deeper approach to find out what's the problem. Is your liver having trouble managing any excess hormone metabolites or recycling those or breaking them down properly? Are we having trouble actually producing those because you're having HPA axis disorder that's basically causing your ovaries not to produce those hormones properly? Or do we have an adrenal issue going on where your adrenal is actually stealing those hormones away so you don't have enough bioactive, bioavailable hormone out there to balance and do its job? So a couple different factors to think about. My plan is the rest of this month is to actually go over each of those individually and go into more detail to help educate you more. So if any of these sound like you want more information about it, make sure you tune in, subscribe to our channel. Every Wednesday, 5 o'clock, I have a new video. So make sure you subscribe. You can also hit that alarm bell down there as well, and that'll also help to alert you when we have a new video release. So like I said, the next couple weeks, I'll be talking specifically about those 3 types of hormones and kind of an approach and multifaceted things you can do to help or evaluate that. Or if you're local, you can also come to the office and I can evaluate that for you and kind of go over my recommendations for where you should be and where you should start with that. So hopefully you have a great rest of your week. Have a good day.